Hi, good morning. My name is Dr. Behnam. I'm a board-certified dermatologist, and today I'm going to be giving an educational consultation on hair loss treatments. When patients come into our office for hair loss, one of the things that we do is look at the scalp. Obviously, looking at the hair. Sometimes we might take some of the hairs out, look under the microscope, or basically just apply a magnifier onto the scalp, basically, and see exactly what's going on the scalp. There are many different types of hair loss. Typically, hair loss is divided into scarring alopecia and non-scarring alopecia. Alopecia is a generic name for hair loss. The most common type of hair loss that we see is male pattern or female pattern hair loss. These are typically genetic pattern hair loss. So we usually ask the question, who's losing hair in the family? Grandpa, grandma, uncles. A lot of patients come in with the myth that a lot of hair loss is typically, it comes from the mother's side, but that is not true. Hair loss comes from both sides, the mom and the dad. So it's not typically just one side. So if somebody in the family is losing their hair, like an uncle or grandpa who's bald, then you're more likely are genetically predisposed to losing hair. Sometimes that hair loss gets accelerated when you're undergoing like a lot of stress, or when you have some vitamin deficiencies, vitamin D, vitamin B6, B12, or some iron deficiencies, or some thyroid deficiencies. So when somebody comes in, the way that we do the exam, we look at the scalp, we make sure that there's nothing weird going on, or some of the rare type of hair losses. We ask a lot of questions about family history, and then we also typically do a lab, typically in females, to check the iron level, ferritin level, thyroid, and vitamin levels. A lot of doctors do check the iron level, but that it's really not accurate. What is very accurate is what's called the ferritin level. If you really want to know the amount of iron that's in your body, ferritin is the number one most important thing. And I have seen very, very, very low ferritin levels in some of my patients. We want to keep the ferritin level above 70 to 75. That's what gives you basically a very healthy hair. So some patients come in with a low vitamin D and a low ferritin level, and they complain that they're losing a lot of hair. Some of the times when we address those two issues and patients take the vitamin D and iron, and those levels go back to normal, they already notice that some of their hairs basically gets better. Once we, in the consultation with the patient, kind of determine what's causing the hair loss, we then go into the treatment protocol, which basically what it is, how are we going to treat the hair loss? And there's really mainly 5 to 6 ways of treating it. Number one, there's some pills you could take. For males, there's something called finasteride, which is also known as Propecia, and for females, there's something called spironolactone, which is also known as aldactone. In males, Propecia has been used for many, many years. The history of finasteride is that it was originally used for prostate cancer years ago at the 5 milligram dose, and people realized that at that dose, not only it shrunk the prostate, but it also caused hair growth on the scalp. So then Merck came up with the 1 milligram of finasteride, which is also known as Propecia, which is FDA approved for hair growth. It's been used by millions of patients around the world. Majority of patients have very good improvement on Propecia, and it is still the number one choice basically by most doctors and dermatologists around the world. However, just like any pill, Propecia also has side effects. One of the most common side effects are sexual side effects. Typically in my office, we go in thorough details basically into the sexual side effects. Typically this includes decreased libido, which is decreased erectile dysfunction, which would decrease sexual interest, erectile dysfunction, which is ED, testicular pain, so basically anything that's related to the sexual function. There are a lot of studies done, and the risk of some of these sexual dysfunction is about 1.8% of patients. Now this doesn't mean that you're going to get it, but about 1.8% of patients could get it. If you look at some of the placebo studies, patients that never took any Propecia had some of these sexual dysfunctions, about 1.3% of patients. So it's just slightly higher than the placebo group, which means the group of patients that never took Propecia. One thing that we do in the office that is a trick that we employ in order to reduce the sexual side effects, and that is that don't take the pills every day. My recommendation is that do the pills start twice a week, Monday and Friday. I know when guys typically want to get started on Propecia, they want to see the results right away, but usually the results takes about 3 to 6 months basically for people to see it. So, and remember, it's not a race. So my recommendation always is to start slow and titrate up slowly. So start twice a week, and every 2 weeks add an extra night. So do it like Monday, Friday, or Wednesday and Friday, and every 2 weeks add another night, and 2 weeks after that you add another night. So you're going from twice a week to 3 times a week to 4 times a week, and you keep doing this until you're taking the pills every night. By doing this, your body does not get a shock from the Propecia, and as a result, you're less likely to have some of the sexual side effects. Other side effects that people talk about with Propecia is gynecomastia, which is breast enlargement. This is why we see the patients back every 6 months to make sure that they're doing okay. There's also a risk of depression with Propecia, so I always screen my patients for depression and make sure that they don't have a history of depression, make sure that they're not depressed right now when they're taking it, and if I tell them, if you ever get depressed on Propecia, please call the office up and stop the medications right away. So Propecia is one of the mainstay treatments that we have for hair loss for males. For females, it's called spironolactone. Spironolactone is used to treat high blood pressure medication. Not a lot of doctors use it anymore because there are better medications out right now, but it's still quite effective in dermatology. Dermatologists use spironolactone for 2 reasons. One is for acne, adult hormonal acne, and also for hair loss. The hair loss dose has to be at least 100 milligrams. I see so many patients that they go to other doctors and they put on either 25 milligrams or 50 milligrams, but it is not going to help. You need to start at the 100 milligram dose. You need to have a lab test initially to check your potassium and kidney functions, and you need to repeat those lab tests about 1 to 2 months out again. And then after that, you just repeat it once a year. Spironolactone, the results are seen typically about 3 to 6 months. There's some female patients that swear by it. And some of the side effects includes breast enlargement or breast tenderness, irregularities between periods, spotting between your periods. Some patients could get a little bit dizzy or lightheaded because of the blood pressure medication, but that's actually kind of a little bit rare. So I typically tell the patients to take it at night. You should avoid drinking coconut water on it or eating bananas and sometimes even avocados because of the high potassium content. Spironolactone will increase the potassium level in your body, so you don't want to eat stuff that are high in potassium. And also it's a diuretic, which means it's going to make you pee more, go to the restroom more, so some patients find that they might lose a couple pounds of water weight on it. With both Propecia and spironolactone, once you start, you pretty much have to be on it for a long time. And again, they take 3 to 6 months basically for them to work. The second treatment option that we have in our office is topical finasteride. It's a formula that we came up in our office. So instead of taking the oral Propecia, there is topical Propecia that we compound at the pharmacy and mix with several other ingredients. Typically, there are about 3 ingredients in it, and it is very, very effective. Especially when you come in with oral Propecia. But we have patients that use the topical finasteride in our office, and we have found that it causes the hair to grow faster than the oral Propecia, and it's pretty much as effective as the oral Propecia. The reason is because you're applying it topically onto the scalp, whereas when you take something orally, a lot of it goes to the rest of the body, and only a small portion of it goes to your scalp. So that is only exclusively in our office. Number 3, there's a shampoo called Nizoral. Nizoral is also known as ketoconazole. It's an antifungal shampoo. In clinical studies, it's been shown to stimulate hair growth. It's probably not the best shampoo in the world, but in some patients, it actually helps quite a bit. I have a lot of female patients that use it. The fourth option that we give our patients is a protein shake. So Dr. Shapiro came up with a protein shake called Help Hair Shake. It's a whey protein concentrate. I am a big fan of it, and typically a lot of my female patients like it. There are 2 types of whey proteins. There's the whey protein isolate, and there's the whey protein concentrate. The isolate is what you could get at any GNC, and this is what muscle builders take. And actually, the isolate will cause hair loss. So I typically take a lot of my male patients off the isolate and switch them over to the whey protein concentrate. I think Dr. Shapiro has done a great job with his protein shakes, but you could also buy the whey protein concentrate pretty much anywhere on Google, on the internet, so I highly recommend that one as well. The sixth option for hair loss is some of the laser caps. The laser caps gained quite a lot of popularity in the past 1 to 2 years. We still somewhat not definitely sure if it works for all patients or not. I personally do have some reservations about it. There are some patients that are on it. However, we don't typically usually recommend it for our patients. So with respect to all these treatment options I just talked about, we usually like to combine these treatment modalities because remember, hair loss is just not because of one reason. It's typically like you're genetically predisposed, there's stress factors, there's hormonal factors, there could be thyroid issues, so there's multiple different factors. So the more of these options that I just explained, the more of this stuff you do, and when you come on together, the better results you get. So typically what we do, we put the patients sometimes on a topical plus an oral, and also have them take the shake, and all of this combined together give patients like a really good results. Remember, it takes few months for patients to see the best improvement. So a patient that comes in and says, look, I want to see immediate result by next week, that's not going to happen. So these were typically the medical ways of treating hair loss.